Welcome to Easy Anatomy. In this video, we are going to discuss basic directional terms, anatomical axes, and body planes. This knowledge helps in describing the structures of the human body, identifying their exact location, and understanding their relationships to each other and to the standard anatomical position. In this position, the person is standing straight, with the upper limbs down at their sides, palms facing forward, and thumbs pointing outward. The lower limbs are positioned parallel, with the toes pointing forward.
Watch more videos in the Easy Anatomy app. With Easy Anatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download Easy Anatomy from the link in the description.
There are three main imaginary anatomical planes that intersect the body. The sagittal plane. It divides the body into right and left parts. The sagittal plane can pass either off-center or perfectly along the midline of the body. In the latter case, it is called the median or mid-sagittal plane. The frontal or coronal plane. It divides the body into anterior, front, and posterior, back parts. The transverse or axial plane. It divides the body into superior, upper, and inferior, lower parts. An anatomical axis is a line around or along which movement occurs. Knowledge of these axes will be useful when studying muscles and joints. There are three anatomical axes. The sagittal axis, which passes from front to back, the frontal axis, which passes from left to right, and the vertical axis, which passes from top to bottom. There are several paired characteristics used to describe anatomical structures. Superior and inferior. Superior means closer to the head, while inferior means closer to the feet. For example, the sternum is superior to the pelvis, but inferior to the frontal bone. You may also encounter the terms cranial and caudal. These are almost the same as superior and inferior. The closer a structure is to the skull, the more cranial it is called, derived from Latin cranium. And the closer it is to the tail, the more caudal it is referred to, derived from Latin cauda. These terms are often used to describe embryonic structures. The next pair of terms are anterior and posterior. The synonyms are ventral and dorsal, derived from the Latin venter, meaning belly, and dorsum, meaning back. If referring to a structure of the head or brain, instead of ventral, the term rostral is used, from the Latin rostrum, meaning beak. For instance, the frontal lobe of the brain is rostral to the cerebellum. When describing the feet or hands, the term dorsal refers to their back surface. The front surface of the hand is described by the more obvious term palmar, and the sole by the term plantar. The next pair of terms describe the proximity of a structure to the median plane. Medial means closer to the median plane, and lateral means further from the median plane. For instance, our eyes are medial to our ears, and the ears are lateral to the eyes. Another pair of terms are external and internal. They usually describe the position of a structure relative to the center of a particular organ or cavity. For example, within the thoracic cavity, the heart is located more internally compared to the ribs. The terms superficial and deep describe the position of an object relative to the body surface. For example, the skin is more superficial than the muscles. The last pair of terms are proximal and distal. They are used to describe structures that have a beginning and an end. The closer to the beginning, the more proximal, and the closer to the end, the more distal. For instance, the proximal part of the humerus is involved in forming the shoulder joint, while the distal part is involved in forming the elbow joint. There are also four terms of laterality. Unilateral. The structure is located only on one side of the body, for instance the spleen. Bilateral. The structure is located on both sides of the body, for example the kidneys or lungs. Ipsilateral. Several structures are located on the same side of the body, for example the left kidney and the left lung. And contralateral. One structure is located on one side of the body and another on the opposite side, contralaterally. For instance, the left eye and the right kidney. Alright, here's a quick summary. In anatomy, there are 3 planes: sagittal, frontal, and transverse. If the sagittal plane intersects the body perfectly along the midline, it is called the median or mid-sagittal plane. There are 3 anatomical axes: the sagittal, frontal, and vertical axes. The following pairs of terms are used to describe anatomical structures: superior and inferior, cranial and caudal, anterior and posterior, ventral and dorsal, medial and lateral, external and internal, superficial and deep, proximal and distal. Also, keep in mind the terms of laterality: unilateral, bilateral, ipsilateral, and contralateral.